So in this health alert, joining us now to talk about the psychological factors of dealing, of course, with the coronavirus. So glad to have you here. And we're going to talk about how to keep your kids calm as well. This is Dr. Roseann Capanna-Hodge, or Dr. Roseann.
That's right.
Call you that. So first off, knowing that kids are going to be hearing about the coronavirus on the news from their friends, what should parents be doing and talking about with their children?
Yeah, so, this is on everybody's lips. You can't go anywhere without hearing about it. So what parents need to do is they need to talk to their kids, and they need to calm their own worries first. And before they talk to their children, they need to talk to them in a developmentally appropriate way, just the facts. They need to reassure safety. We are very worried about the coronavirus. That is true. But we should also be worried about the flu. And what parents need to do is talk to kids in a relatable way and say, remember when you got sick? You got through it. Let's talk about what we can do to prevent getting sick. Talk about hand washing. Talk about what are foods you can eat to keep your body healthy, to resist infection. That's where parents need to start. And then they need to have the conversation with their kids about the kids' worry. What are they actually worried about? And for myself, coming here from Ridgefield, Connecticut, my own son said to me, who's 9, said, "Mom, are you worried about the coronavirus?" And I said, "Giancarlo, I'm not. Mommy takes a lot of vitamins, she eats really healthy, and I wash my hands." Yeah. And I think that he literally said, "Okay, Mom," and he went on his own. So not to make light of it, but we really need to give kids information and reassure safety whenever we can.
And going back to what you said, the facts and having these kind of conversations, because there are a lot of rumors out there. California is also kind of the tip of the spear when it comes to the cases that we saw pop up here. We've just had our first, well, not California, Washington State, but the first death from the coronavirus. Yes. So it's out there, the news.
It's out there, and kids are going to be fearful. Adults are fearful, and so we need to, again, reassure that safety, but really teach kids about what they can do to stay healthy. I think is really, really important, from hand washing, trying to eat as many fruits and vegetables as they can, not really eating junk food. That's ways to really power up the body, because even though we have the coronavirus, many more people are dying from the flu. And we're not focusing on that. And I think that we need to really teach all families on how to have prevention from illnesses, and it starts at home. But whenever your child is excessively worried, you need to honor that. You need to look for signs of worry, problem sleeping, tearfulness, and really pay attention if you are a parent that travels a lot. Your children may have more heightened anxiety, and so you need to validate their worries and say, I hear you're worried, but Mom and Dad are going to be okay.
This really is a lesson in Health 101. Just saying there are such simple steps to take, as you mentioned, to protect yourself, and that's what it comes down to.
Absolutely, 100%.
If we don't give the virus a place to live, it's not gonna, we can stop it.
Absolutely. And, we think about, using hand sanitizer, but really the research is showing us that hand washing and 30 seconds of hand washing is way more effective. And, teaching kids, showing them, keep your hands away from your mouth, keep your hands away from your eyes. But, when kids, and there are kids that are more anxious in general, and there are some kids that are going to be more affected by this. And so parents need to be present. They need to put down their phone, and they need to have conversations about their kids' worries and teach them ways to feel better about those worries.
You're so easy to talk to. You're reassuring me, so I can only imagine how lucky your own kid is. And do you think the anxiety, it's going to obviously differ as a kid gets older, or is there a certain age that we should be worried about the most in terms of them taking all of this on?
Yeah, great question, because across the developmental spectrum, including adults, they're worried. And so each age is going to require different conversations. Some kids, a teenager may avoid you. You might see a change in their behavior. So you just want to open up those conversations. I think that whenever a child or a teenager already has pre-existing anxiety, you really want to make sure and check in with them at a higher level, because they may be more affected. And so, and reassure them, talk to them, find out what they know. There's a lot of misinformation out there.